Look, the cancer treatments have evolved over the last couple of decades, and they have really improved cancer care dramatically. The 5-year survival for all cancers combined in Australia is now in excess of 70%.
When I started the chemo, I ended up having to have a double lot of chemo. We got a month from the end and I had a lump come out on the side of my neck. Then we went from the second round of chemo into the ray treatment, and then it was like, okay, I'm home and hosed now, it's all over. So that was 15 years ago. Then 6 years ago, I had a couple of health things, so they did scans of that and it turned out it metastasised and come back as a tumour on the outside of my lung. A bit of it was in my spine, which still is, and I was diagnosed as stage 4 terminal. My prognosis 6 years ago was 6 to 18 months.
But what is important to remember is what are all those drugs actually aiming to achieve? These medications are aimed to kill cancer cells, stop them from growing, stop them from dividing, stop them from spreading. But some of those effects spill over. And with my interest in heart health, if we deprive cells from oxygen or reduce their blood supply, that is really bad for the heart cells. They rely on that to function. If even a little bit of that side effect affects the heart, that's how the damage occurs.
Probably 2 years before that, I had an acute cardiomyopathy attack, which I had no idea at that point about the link with chemo and heart problem. I just didn't know the heart thing was a thing. And even when I got the acute cardiomyopathy, I didn't know that that was really a direct result of all the chemo and that I've had.
Our dedicated cardio-oncology clinic that we've ran now for 7 years in the Hunter, we have had more than 4,500 patient visits. And that's really been informing our directions of research. We started seeing these people early on, where they come into our clinic with well-established, difficult to treat late-stage heart disease.
I started to go into AFib all the time. So that's atrial fibrillation. And then that my heart would just go up to 200 beats a minute for no apparent reason and then drop back down. And we didn't know what the answer to that was, and Aaron kept chasing till we found an answer. I've now had the ablation treatment. I haven't had AFib since the 12th of September.
And so, whilst this is a very good news story, what we want to make sure is that there are less people like Jackie in terms of we don't want people to develop heart failure to begin with. We want to protect it up front. So if the treatments are toxic, can we discover either less toxic treatment or ideally combining 2 anti-cancer drugs that will give you better cancer outcome, and at the same time each other protects against the toxic effects on the heart.
Investigating whether or not anti-cancer therapies could be used together for both anti-cancer effects as well as being cardioprotective is completely out there, a strange concept. We have managed to discover with an Australian biotech company, one of which is going into some more clinical trial testing. We have also discovered 2 more, and the most important finding is that it allows us to potentially use it for multiple different other cancer types.
An estimate has been made that it's worth about $1 billion per year worldwide if successful in reducing the healthcare burden for people. The blue sky vision would be that no patient develops heart disease related to cancer treatment. Whilst it might take some time to achieve, it is achievable as cancer treatments improve, as our understanding improves. And then very importantly, having this holistic, dedicated cancer survivorship program accessible to all patients, not just the ones who live in a particular affluent area or in a capital city.
I could be your daughter, sister, mother. When it touches your life, if you have the ability to make a donation towards this wonderful group, it could end up being something you're donating towards somebody in your family that you care about, that actually this research is going to help towards saving lives and making lives longer. I just think the amount of effort they put in is just enormous, and I certainly wouldn't be alive now without that.